Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinda Higgins.
And this is A Pod Full of Pediatrics. Subscribe here for more content.
Or go to onecommunityhealth.org.
Or follow us on social media at One Community Gorge. And this is the one where we talk about headaches and concussions. All right, so headaches are super common, right? Like, we don't think about kids having them, but we know kids really do have them from a pretty young age.
Yeah, we see it a lot in practice, like in the sense of, like, probably at least once a week I have somebody coming in saying, hey, I have a headache, or I've been having headaches, and like being worried about it and wanting to know what to do about it.
Yeah, and about 60% of kids between the ages of 3 and 18 will complain about headache at some point, and they're rarely ever caused by anything serious.
Yeah, and then headaches increase in age from about 4.5% for age 4 to 6-year-olds to 27% among children of age 16 to 18. And interestingly, it is really pretty rare to have headaches less than 4. So whenever I have like a 3-year-old, like one can be communicative enough to tell me they have a headache.
Exactly. That actually can like associate the symptoms.
I know, and then say they have a headache. I always worry a little bit more. And that's a little bit about what we talk about here, is that for the most part, headaches are not anything that you have to worry about. We just can give you ideas about how to help treat them. But there are some red flags that we'll talk a little bit about too, and those we worry more with.
Yeah, and we talk about primary versus secondary headaches. So primary headaches means you just have a headache for having a headache, whereas secondary means something else is going on and that is causing the headache.
Yeah. And so we'll talk about those. The primary ones we kind of talk about first, because those are the ones that most people think most about when they think headache.
Right. So migraine is the one that gets the most press, I think. And in kids, it tends to be on both sides of the head, whereas in teenagers, it tends to be more on one side of the head.
Teenagers and adults, adults more on one side of the head. And then it is recurrent episodes of head pain that are typically pretty severe pain, like moderate to severe pain each time. And the duration is usually 2 to 72 hours.
Yeah, they can go on for days, right? And it's a throbbing pain that gets worse if you move. And it really, I mean, we both have migraines. You know that you're just you don't even want to touch anything. You don't want anything to touch you, and you don't want to touch anything because it just hurts.
You just crawl into bed and stay in the same position. They in the dark, because they may be accompanied by certain things like nausea, vomiting, light sensitivity, which is another name for photophobia, and then sound sensitivity or phonophobia.
Right. And to diagnose migraine in children, you need to have them have at least 5 headaches that look pretty similar to this.
Yeah, have those characteristic features of them. Yeah.
And about 10% of kids will have an aura with migraines. And aura is like that thing that happens before that you know you're going to have a headache, right? Like I get a flashing silver light over here, or I just lose vision in one of my eyes and I'm like, oh,
yeah, weird vision things that can happen before you have a bad headache. Those are your auras. And auras actually are really not that common, or at least kids often don't
recognize them. But they see a lot of weird things anyway. So, and they really do run in families. So there's definitely a genetic link. And, I do want to do a little shout out to my friend Jen from college, because she had migraines in college and she'd be out for a weekend and we're like, ugh, what are you just trying to avoid things? And then the first time I had a migraine, I was like, I'm so sorry, Jen. It's terrible. I understand why you didn't want to move at all.
Yeah, I know. I was similar. I didn't have one until, after we had all my babies. And then I was on my way to work one day and I had to stop and pull over because I couldn't see well and I was vomiting. I was like, oh my gosh, and my head just hurt so bad. Once you treat them, you can kind of still get on with your life. But it is a matter of kind of paying attention to what they are, what triggers them, and how we can treat them.
For sure. Second kind of headache we talk about is tension type, which we've all had those, where it's that tight band kind of around your head that no matter what you do, it feels the same. So it doesn't really change with activity. It's just constant. Kids often don't say band around the head. They'll say my whole head hurts, but it's not really a throbbing kind of headache. It's just a pressure.
It is still mild to moderate in severity, and it doesn't worsen with activity. So it's just bad the whole time.
Right. And it's going to be like a half hour or a few days.
Yeah. And then this is probably one of the most common ones. And I feel like a lot of times you have muscle related things with it, right? Like you'll have shoulder pain, like kind of neck into
even
your head
jaw pain
sometimes. Sometimes. Yeah. Like this is what we talk about, tension but stress, or like kind of that type of thing. And then you have cluster headaches, which we don't see very often in kids, but can be pretty debilitating if they're having them.
Yeah, and they tend to be on one side or kind of in the front by the eyes, and they usually last about 1 to 3 hours, and really call them clusters because you'll get multiple headaches in a short period of time.
Yeah, so like even though they're only lasting 1 to 3 hours, you're going to have another one 3 hours later, or 6 hours later type thing, and you're getting multiple.
And often kids and people will. Kids are people. Kids and adults will seem sick when they have cluster headaches because they'll have like redness of the eyes, their eyes are watering, they'll be maybe a little congested, and they get like kind of some facial swelling sometimes.
Yeah, and they are pretty bad. Again, we don't see them quite as often in kids as you might see them in adults, but they are pretty severe when you do get them. We talk about secondary headaches as well, and secondary headaches are most typical cause of a secondary headache is a viral illness.
Actually, everything in a kid's life, most typical cause is a viral illness, right?
That's right. But the interesting part about that is that, like, again, usually, and that's actually probably one of the most common causes of headache that we see in clinic. Like, come in sick, they have a fever, they don't feel good, they have a headache, right?
Yeah.
Those are kind of pretty easily diagnosed as secondary viral type headache. But there can be some more severe viruses that we have to really worry about other things that are causing the headache. Like if you have bad neck pain and fever and vomiting, you're worried about meningitis,
For
right?
sure, yeah.
And so you also can have post-traumatic headaches. So we're going to talk about this a little bit later, but like concussion can be a common cause of a secondary headache.
Yes. And then, the things we don't want to miss absolutely are things that are like brain tumors in your head, right? They will give you headaches, but they're not going to present the same way as a primary headache at all.
Yeah, and then we'll talk a little bit about those red flags that we think about when we are looking for those things. But the cool thing about headaches...
There's some cool things about headaches.
There are some cool things. One of the things that I find cool about headaches is that treatment is very similar no matter what type it is.
Absolutely.
So if it's a primary headache, whether it's a migraine, tension type, and those, we actually still kind of think about them and treat them the same way.
And the things we recommend are the things for just good living.
Yes.
Get more sleep, drink more water, eat consistently, keep your blood sugar pretty stable. Don't, a lot of these adolescents don't eat breakfast, don't eat lunch. Yeah, they're going to have a headache. It's
kind of funny because you actually start the same thing with headaches, right? For all of them. And you're like, hey, let's try a headache diary. They look at you like you're crazy. And then the second thing we do is say, hey, how are you sleeping? And, they're all like, And then you're like, hey, do you eat breakfast in the morning? And they're like,
You're like, here you go. We solved all your problems right there.
Like, drink more fluids. Make sure you eat regularly. Make sure you get a good amount of sleep. Those are all going to be the biggest things to reducing your frequency of your headaches.
And treating. And I make a point of saying drink mostly water because there's definitely been some correlation with some sugar-free beverages. The things we use as fake sugar can actually cause headaches or prolong the headache.
Yeah, and these are all like after we've saying this, we do when they come into the headache, we do a really good history and a physical exam, and that's really what's going to differentiate those red flags or worrisome signs or sometimes you find like one of the red flag worrisome signs is an abnormal neurologic exam, right?
Which is super rare, but that's why you should see your doctor to make sure.
But that's why you see them, and then we do often ask that family to do the headache diary because it is really helpful in finding triggers if there is a problem or there's something triggering a headache.
Yeah. So when you actually have a headache, it's fine to have your kid take some Tylenol or ibuprofen when they first start having the headache, especially if it seems like it's me a migraine. As soon as they start getting a headache, take the medication.
I even encourage them really to have this like with them at school if they're having bad headaches, and a note that says that they can take it because, really getting in that dose as quickly as possible before it's gotten pretty severe and they're nauseous and they can't keep it down is actually really helpful. For sure. And we say, like, Joanne does the Tylenol or ibuprofen first. I'm like, just hit it with both. Just
I usually have to give one a chance to work before you go to the other one, so then you have two things to work with. with, but Corinna's like, just slam it down.
Get rid of it.
They're both okay.
Yes, and the only thing about ibuprofen is that if it is like your migraine or say your cluster headaches where you're having them frequently and periods of time that are pretty close together, you might end up using ibuprofen daily for a while. And actually, that's not what you want to do. You don't want to use ibuprofen more than 14 days a month because it can cause like rebound headaches that can be pretty significant in and of themselves.
It's also hard on your stomach too.
It is, yes.
And a lot of times with kids who have nausea and vomiting with the headaches, we'll prescribe Zofran on Dancitron just to help them be able to drink and to sleep without puking.
And Zofran I really like. It is a dissolvable tablet. It doesn't have the best flavor, but it's really fast.
Fine. When you're nauseous, do you really care? No.
And it works fantastically.
Yes.
It really is a wonderful treatment for nausea. Second tier treatments for your migraines or headaches. And this is actually interesting to me because, you have all of these things as your first line treatment, but really besides Tylenol and ibuprofen, none of them medicines, right? I mean, Zofran for nausea, but this one is even less medicines because it's like cognitive behavioral therapy and feedback therapies. And biofeedback therapies have actually been proven to be really helpful.
Absolutely.
In treatments of headache, recurrent headaches, or especially your cluster headaches.
Yeah. And then acupuncture and massage definitely been a help for people who have,
especially tension or stress type headaches.
Right.
Yes, absolutely.
Headaches. And then herbals or vitamins, they actually, there's been little support, but anecdotally, little evidence, but anecdotally, they seem to help with riboflavin, magnesium, and coenzyme Q. And they're super safe to try. I personally, there's a product that's a combo of riboflavin, magnesium, and this weird herb named Feverfew called MicroLeaf that really helps when I am starting to have headaches.
Yeah, and what's interesting about those, right, is that if you go to neurologists, that's actually one of the first things they recommend is just your baseline preventative therapies, as they're these kind of herbal or vitamin therapies. And again, while there's not a ton of evidence that they're super helpful in preventing the headache, there's a little, and they are at least dosed in a way that we know they're pretty safe at the doses they recommend.
Yeah, and then the third tier, for those migraines, especially that are not responding to other treatments, we sometimes prescribe triptans, which sumatriptan is like the most common one.
Yeah, and these are serotonin agonists, which help headaches by promoting vasoconstriction, which is kind of that, like the actual vessels kind of constricting, and that actually blocks pain pathways in the brain. They have been shown to be very safe and effective for migraine treatment in kids and as an abortive therapy, but there are times that you can't use them and times you shouldn't use them. And so again, that should be done through your doctor.
Yeah, but again, the whole key is prevention. So when your doctor asks you to do a headache diary for your kid, do one because it's so helpful to figure out the triggers. And as we talked about, the most common triggers for kids and probably adults too are insufficient sleep, inconsistent blood sugar, insufficient water consumption.
Yeah, so doing those really helps. And then caffeine does have a really interesting relationship to headaches. If you have too much caffeine, you can get headaches.
Right.
So like if that isn't often one that you look at on your headache diary, that's part of it. But also if you drink caffeine regularly and then you stop for some reason,
you get a headache.
You get a headache. Like caffeine withdrawal is real.
Yes.
And usually causes headaches. So it is important to make sure that you know, and those dietary or diary for headaches can be really helpful.
And it's also in some medications to treat headaches.
Yeah.
So we can prevent with it and we can treat with it.
I actually like my Excedrin migraine.
I actually like a chai tea when I'm starting to get a migraine. So it's just a very little bit of headache.
For kids who are having really frequent incapacitating headaches, there are a few medications that sometimes we can try to prevent headaches. We'll do that sometimes, but a lot of times too, like when you've gone through all these things, nothing's getting better. We're also thinking like, okay, is there something else we're missing? We might be thinking about imaging or making sure there's nothing else like kind of funky in the brain or something happening. And then sometimes we will refer to a neurologist as well. But we or neurologists tend to use the same medicines each time.
Yeah, so the ones that we know are safe are cyproheptadine, amitriptyline, some of the beta blockers, and Topamax.
Yeah, and all of those work. They are not ones that work without side effects sometimes, which is why you never start with those medicines. These are ones that really we use because nothing else is working. We've tried all these other things. We kind of are ruling out bad things and then trying to figure out how we can help with these really bad headaches.
So the red flags for headaches are the timing of them. If they are waking your child up during the night or early in the morning, that's very concerning.
Headaches that happen with straining, steadily worsening, or headaches that are associated with mood changes. Like all of a sudden, like there's headaches and they really change their mood or affect. And then, like we said, if there's any weird neurologic stuff, that tend to be like worrisome for us.
Exactly. So let's talk about one cause of headaches, or concussions, which the definition of concussion is a mild traumatic brain injury that affects brain function. So you really need both of those things. Something has happened to hurt your brain and it's kind of messing up your daily life.
And it's most commonly from like a fall or blow to the head, but they actually can occur with just sudden acceleration or deceleration, such like in a motor vehicle accident, if somebody's in a car, less in a car seat, but in a seatbelt or that type of thing.
Yeah.
So you don't have to necessarily, if it's a bad accident, you don't necessarily have to have hit your head to still get a concussion.
There. And, you know, they're pretty common, right? In 2016, it said 19.5%, study said 19.5%, not 20, 19.5% of U.S. adolescents in grade 8, 10, and 12 reported at least one diagnosed concussion during their lifetime. And 5.5% reported having more than one concussion.
Yeah. Involvement in competitive sports was associated with a greater odds of lifetime diagnosis of concussions, and most of those concussions were from player-to-player collisions. You know, this is interesting because when we were young, really nobody cared about concussions.
Yeah, I mean, the rate of concussions has really increased because now we're actually diagnosing them more.
We pay attention to them.
Yes.
Yeah. I mean, like when we were young, we didn't really pay attention.
Were you ever diagnosed with a concussion?
I was not. Never diagnosed.
Did you ever have a concussion?
I totally had multiple concussions. Like I did some pretty good damage to my brain.
Yeah.
But we didn't even talk about it, right? Like, and most of my concussions, I played competitive soccer all the way, like even through medical school. And
I played soccer also, but not competitive soccer.
You didn't have a concussion.
I didn't play competitively. I just was out there.
But yes, and most of my concussions were like heading, you know, going up and heading the ball. And I don't feel like I ever got heading itself that caused the concussion. It was that I had hit somebody else.
Yes.
Somebody else would be going up at the same time. We'd smack heads, right? Broke my nose a couple times, you know. Like,
when they broke it again.
I broke it once and went one direction, but then I broke back and it was perfect. So like luckily it was good. Got a concussion both times.
Right, but you never stopped playing.
Never stopped playing. Well, I did because I was bleeding.
Oh, well, yeah. But that's the only reason it took you off, not because you were dazed and had a headache.
No, not because I was dazed or anything else. And as soon as my bleeding stopped, I went right back on, right? Like that was what we did, like back in the day. What we've realized now through some really good studies is that's actually not
a
safe.
Bad choice.
That is a bad choice, and for multiple reasons. Which we're going to all talk about. But we are way better at diagnosing, recognizing concussions, diagnosing, and then treating concussions and use.
So the top 10 youth sports with concussions, from most to least, and of course, number one, we're not surprised, boys tackle football. Yeah. Right? Yeah. But number two, girls soccer.
That's right. And then boys lacrosse, boys ice hockey, boys wrestling, girls lacrosse, girls field hockey, girls basketball, boys soccer, like, right? Boys
Way
and girls
down
soccer,
there,
very different. And then girls softball. What's interesting about this is that we had some really big changes after they did these huge studies showing traumatic brain injury in people who had played sports for long periods of time, and how devastating they could be as they aged, right? Even limiting their life and their total lifespan. And so they made some pretty big changes in a lot of sports.
Early 2000s.
And I do think that has helped a lot. I mean, one of the things they changed for example, for soccer is that you're not allowed to head at all until you're over 14. So basically kind of through puberty is what their thinking was.
When your body stops changing as much on the outside, even though your brain is still growing.
Yeah, and then they have no checking in hockey until age 14 to 15.
Yeah.
Some sports haven't changed as much.
Yeah.
But every sport has really made, especially for childhood, has made an effort to really have their coaches recognize if there could be a concussion and to try to appropriately treat that now, which is a big deal.
Right.
That has changed.
You know, and most of the concussions we do see with sports injuries, we know the thing that's most important is that the kid needs to stop playing right then and be reassessed. So no matter if they say they're okay, if you see their hit the ground, if the whole crowd goes during a play, the kid needs to come out and someone needs to evaluate them, right? Don't just keep on playing.
Yeah. If you see a kid bounce off the ground,
or
even
someone
if it was
else,
something else, or bounce off someone else, it is probably a good idea to assess them off the field.
Right.
Right.
So if they did sustain a concussion, real reason we want to take them off the field is because they're way more likely to have additional brain damage if they keep playing.
Yeah, this is because of many reasons, like their decision making is affected, right? Their reaction time might be delayed. Their visual fields might actually be limited, and they might not be able to see as well.
And they're also at risk for something called the second impact syndrome, right? Which is death or a devastating neurological injury caused by massive swelling of the brain in athletes who sustain a second head injury prior to full recovery from the first head injury.
And in an observational study of traumatic brain injury and spinal cord fatalities in high school and college American football players over about 10 years, there were 4 of the 22 high school players who died had a history of concussion within the previous 4 weeks. So this was really the 4 of the 22 who actually died because they had this second impact syndrome, where their brain wasn't completely healed from the first concussion, and they were impacted by a second.
Yeah, and a lot of high school programs now do neurocognitive testing at the beginning of the season, and then again after an injury to kind of make sure.
Which is really nice.
It's great. It's a really
great.
Objective way to be like, are you back to your baseline?
That's right. And really encourage kids to actually do their best on the study.
Right. I've had people say that before. I did really bad on the first one, so I won't look that bad after my injury. That is not the plan. We want to get you back to your baseline.
And it just makes it confusing because there's always some weird thing like, oh, you did way better in this, but not in this. Like, that doesn't make sense.
Yeah.
So don't do that. Do your best on it, because it does really help us assess when you get back to your baseline. And, you know, when somebody has a concussion, there can be a whole variety of symptoms. They're not always not the same.
Right. Most common definitely is headache, but often they have nausea, dizziness, and then just sleep disruption.
Yeah, they're often tired, but they still have trouble falling asleep or staying asleep, which makes their tiredness worse. And this can really affect their mood,
definitely irritable,
and their ability to concentrate.
For sure. And that's what a lot of parents will tell me. I could tell they were through the concussion and all of a sudden they were nice again. Because they just feel terrible.
And then if a head injury causes any dramatic symptoms, loss of consciousness, vomiting, confusion, that player needs to be evaluated immediately in the emergency room. And this is even if it happens a couple hours later. So for example, you think everything's okay, they were taken off, but then they go home and they have a horrible headache again and they're vomiting and really confused. Go take them to the ER.
Yeah, they need head imaging at that point. They need a CT.
We are worried about a bleed, okay? Yeah. And so that needs to be there. Don't bring them to our office.
No,
we can't do that.
We don't have a CAT scan.
You know, go to the ER.
Right.
Okay.
And as we said earlier, the most important treatment for concussion are rest and removal from the activity. But that also means avoiding other activities for a while. They might have another head injury, so they can't ride their bike, they can't
shouldn't go climb on the jungle gym.
No, let's not set them up for failure again, because they're kind of off. They're more likely to get injured again.
Yeah, so they can take Tylenol, ibuprofen for headaches, but they should limit the amount, especially in the first few days, especially if you're doing it regularly. Again, because that can kind of cause a rebound headache, but also because it doesn't help that much.
It doesn't really help. Your head's going to hurt no matter what. You just smacked it.
Yeah. And then with the initial rest period of 1 to 2 days, that includes cognitive rest as well as physical rest. Mm-hmm. This is a difficult one for adolescents.
Right, exactly. Because we say limit the screen exposure, but what we really mean is limit this close-up screen, right?
Yeah.
The tablet or the phone. if they want to zone out and watch TV or videos, do it across the room with a laptop or a TV.
Yeah, and that actually is really important because if you're right here, you actually get a lot of continued headaches from screens. If they're playing video games, I don't know why, but then they go home and play video games for hours, and they're like, "Oh, I had a horrible headache and I couldn't go to school today." Okay, not the objective.
It's a lot of stimulation there. To your brain is really struggling with stimulation right now.
That's right.
And we do want them to go back to school, though.
Right. And we want them to have social interactions. Like we've actually proven that removing them from everything is not helpful for treating concussion.
Especially in adolescents.
Especially in adolescents. It just makes them more sad and depressed and not feeling good. However, they might not be up to their normal, be able to cognitively do what they normally do after a concussion. And so while we would encourage them to return to school after 1 to 2 days, they may need shorter days. They may need no standardized testing. They need to wait on that calc test.
Right.
Until the end of the week.
Super important to their grade, they should just not do in the next couple weeks.
Yeah, and doctors often will write notes about this. And we actually have fairly good protocols now, again, because there's been some really good studies done about not just concussions, but treatment of them. And so now there is standard to have a return to play protocol and a return to learn protocol.
All right, and they're separate things, right? I mean, we're talking about actual physical activity with return to play, but then we're actually talking about your brain return to learn.
Right. And I actually included 2 examples of those at the end of our resources that your doctor might give you. But athletes should really, before going back to play, should be symptom-free during and after exertion at a given level of activity before progressing to the next level. And each level on that return to play protocol is about at least 24 hours.
Right. So we're talking about probably at least 5 days before they're back into play.
And I feel like if you had a significant concussion, it's closer to 2 weeks.
Right. I would say 2 to 3 weeks for most kids to get back to where they are. And we, encourage them to be patient because they just really want to get back in there. But I always kind of talk to them about, if you want to keep playing for a long time, you have to be patient now and go through this. Otherwise, you're going to mess up the rest of your season and maybe next year's season. And most of these, this return to play protocol is really designed to kind of gradually increase both your aerobic activity and avoid that contact that's going to be more dangerous until you are fully back at all of your level, right? And so if all of a sudden, jogging makes you have a headache, you go back. You didn't pass that level. Yes. You got to go back to the level before, right? And so that's the thing about it is that it is a graduated level, and you have to be symptom-free at that level before you can progress to the next level. And you really encourage your adolescents to be honest. Yes, right? Absolutely. Because again, they want to get back to their sport, but we're like, you want to do it well, right? You want to actually perform at your best ability, and you won't if you don't feel well. And then I also encourage kids not to be sedentary, right? Yes, you had a bad injury, but walking is usually fine. It's not going to increase headaches, right? Yeah. Running and definitely running into people could increase headaches. Absolutely. But your walking often is good. And so we don't want to prevent, or we don't want to cause deconditioning. We don't want to make them, again, socially isolated. Some contact, movement, all good things. It's just that as we advance, if we're having more problems, more symptoms, go back. Take a break. Make sure we're okay before we go to the next one. And definitely, we need to be back to baseline before we return to contact play. For sure. So most kids, about 80%, become asymptomatic 3 to 4 weeks after the initial injury. If the symptoms are persisting, it's time to think about a referral to a multidisciplinary team. Yeah, and if those symptoms are dizziness, balance, visual changes, sometimes a physical therapist can be really helpful, actually. Yeah. If the symptoms are more sadness and irritability, actually, cognitive behavioral therapist can be super helpful. If you're really persisting and those things are not helping, there are some very good
really more tertiary care center based, like neuropsychology evaluations that can be done. And they have their own kind of help with that too. A lot of the same teams. They have physical therapy, cognitive behavior therapy, etc. While we don't have those in Hood River,
we do not have those here in White Salmon. Mm-hmm.
We do have them in Portland, those are where we send people if they're just not improving.
For sure. Okay, I'm Dr. Joanne Smith.
And I'm Dr. Corinne Hankins, and we hope that this information keeps your child safe, healthy, and happy if they ever have headaches or concussions.
All right. Thank you for listening.
Thanks so much.